Good afternoon all. So today I'll be taking a drug expert on Xylometazoline. So it's a nasal decongestant. So can you guys tell me any other drugs in this particular class of nasal decongestant? So what is basically a nasal decongestant? Why do we use a nasal? It's a very common drug, but why do people use it? Huh? Yeah, that's correct.
Block nose to get relief from block.
Yeah, block nose. Okay, basically that's the answer. So some of the other drugs in this particular class is phenylephrine. You guys know phenylephrine? Okay. So let's I'll give you a basic idea on what Xylometazoline is. Okay, so it's an imidazole derivative. Can you tell me some imidazole derivative that you know? Okay, so it's a imidazole derivative. Okay, so let me give you a first overview, a small overview of this particular drug. Okay, so it's basically an alpha agonist. Okay, so it's an alpha agonist. So what does alpha agonist do? What is this? Basically, the mechanism of action of this particular drug is it basically constricts the blood vessels. That's the simple term. It constricts the blood vessels, and it is used as topical application. So when I say topical application, how do you apply this particular drug? It's a nasal decongestant. So how do you take it?
Spray.
Okay, spray, drops. Any other way? Okay, so basically it is it comes as nasal drops and nasal sprays also. There are two kinds of sprays that I will explain to you. Okay, so compared to the other drugs in this particular class, it is less efficacious. Okay, but it has more duration of action. Okay, so it has a duration of action of about 12 hours. Okay, and one more thing you have to know is try to avoid using it regularly. Okay, so three things can happen if you take this particular drug regularly. One thing is impaired mucosal ciliary function. Okay, impaired mucosal ciliary function. Okay, so what is basically the function of this mucosal ciliary? Anyone? Mucosal ciliary, what does it do? The mucus, it clears the mucus from the lungs. That is the function. So if you use it regularly, what happens? Not regularly, sorry. If you use it continuously or more than what it has to be given, this is what will happen: impaired mucosal ciliary function. Okay. Second one is atrophic rhinitis. Atrophic rhinitis. So what is atrophic rhinitis? It is basically the inflammation. Okay, inflammation of the nasal mucosa. Okay, that is atrophic rhinitis. And second one is anosmia. Okay, what is anosmia?
Loss of smell.
Yeah, loss of smell. And third thing what can happen is, okay, it is rebound congestion. What is rebound congestion? It's basically the same thing of atrophic rhinitis only. Okay, so basically the inflammation of the nasal mucosa. So when it happens is, if you use this for more than 3 to 5 days continuously, this is what happens. So you know what's the time span you can use this particular drug, right? Less than 3 days or up to 3 days. More than 3 to 5 days, what happens is these three. Okay, so remember these 3 points. Then, so when you're meeting a patient also who's taking this particular drug, you can ask them, how long have you been taking this particular medication? Have you been taking it for more than 3 days? One point you can ask them. Okay, so this is basically the overview of Xylometazoline. Okay, so it acts on which receptor? Alpha. Okay, so alpha, which types? Alpha 1 and 2. Okay, basically these two. So one more thing about this particular drug is it is a direct acting. What do you mean by a direct acting drug?
Specific.
Exactly. So direct acting means this particular drug acts directly on those particular receptors. That is why it is called as direct acting. Also, this is a potent drug. What do you mean by potent drug?
Very short therapeutic.
Okay. Even in, it's very strong basically. Even in less concentration, it can produce the effect. Okay, so that is basically about the drug. So about the mechanism of action, it's a direct acting drug on these two receptors. Okay, now I'll tell you what each action of each of the receptor. One is alpha 1 causes this vasoconstriction. Okay, and on alpha 2 is very rare actually. It basically acts on alpha 1 majorly. Alpha 2, if you're giving this particular drug on high dose, okay, so this is where it acts when it's given on high doses. Okay, now its clinical uses, let's see. So can you tell me what are the clinical uses of this particular drug? Initially I mentioned, right?
Nasal decongestion.
Okay, as nasal decongestion. Also, this particular drug, okay, even though it's a nasal decongestant, it is given for other purposes also. Okay, one is redness of the eye, okay, another is redness of the face. Okay, and apart from that, it also is given for nosebleed. What is the medical term for nosebleed? Anyone? Yeah. Yeah, epistaxis. Okay, so basically epistaxis and nasal decongestion. One more thing I told. What is that? Redness of the eye. Okay, so these are the clinical uses. Okay, so does it cause end organ damage? Any guess? Okay, it doesn't cause end organ damage, but if since it's a nasal decongestant, there are chances that a patient can use this particular drug on a long-term basis. So if you're using this particular drug on a long run, it can cause end organ damage. Okay.
So before that, whether it is intersystemic circulation.
Yeah. Okay, and some of the brand names, let me tell you. Some brand names are Afrin, okay, Dristan and Nostrilla and Sinex. Okay, have you heard any of these names? Afrin is a very common one, and Sinex also. Afrin, Sinex, Nostrilla. Yeah. Covanase is also there. So basically, this one, okay, so this is also a particular brand name. One more is there that I will tell you. So next is the contraindication. Okay, so contraindications are, one is hypersensitivity. Okay, one is hypersensitivity, and second one is narrow angle glaucoma. So I told, right, this particular drug, it is also given for the redness of the eye. So basically it acts on the blood vessels that is there in the eye also. Narrow angle glaucoma. Okay, and it's also contraindicated for atrophic rhinitis. Okay, patients having atrophic rhinitis also it is contraindicated. Okay, and also transphenoidal hypophysectomy. Anyone know what does that mean? Transphenoidal hypophysectomy. It's basically a surgery, okay, to remove what? The pituitary. Okay, for removing pituitary and other intracellular tumor. Okay, so these are some of the contraindication. So now let's come to the doses. So it doesn't have any dose adjustment that is required. Okay, So let me tell you what is the adult dose. Okay, so I told you one more thing, right? What are the types of nasal, what are the types or the dosage forms I have told, right? One is nasal drops and nasal spray. Okay, so drops, you give it a 0.1% solution. Okay, 2 to 3 drops. And every 8 to 10 hours. Okay, so this particular 2 to 3 drops is in each nostril. Okay, in each nostril you have to give 2 to 3 drops. Okay, now the second one is two types of sprays are there. One is the regular spray and one is the metered spray, right? Okay, one is the regular one and one is the metered spray. Okay, again in the spray the concentration is 0.05 to 1% to 0.1%, and the metered spray is 0.1%. Okay, time is the same, 8 to 10 hours. Okay, and next is can it be given to children? It can be given to children only above the age of 2 years. Okay, don't give it to children below the age of 2 years, and it's a category C drug. Okay, it's a category C drug. What is category C drug?
Risk-benefit ratio based on.
Yeah, based on risk benefit ratio you can give. Okay, and so what did I say about the mechanism, mode of action? I told it in the mechanism of action, right, briefly. So what is the mode of action? It stimulates the alpha, alpha 1 and alpha 2 alpha adrenergic receptors. Okay, in where all does it act? In the arterioles. Okay, arterioles of the nasal mucosa and one more place. What do you call this? The conjunctiva. Okay, yeah. So what is the mode of action? It stimulates the alpha adrenergic receptors in the conjunctiva and the nasal mucosa. Okay, now what are the ADRs? Okay, now what are the ADRs? One is headache, okay, other is nausea, and other is dry nose. Okay, these are some of the ADRs. Now some of the general consideration I will tell you. So basically when you're seeing a patient who is having this particular, who's taking this particular drug, some of the things that you can ask them, so that I will tell you. So one is you have to know that this particular drug can be given only intranasally. Okay, you can't put it on your eye or anything. Okay, intranasally only. And before you take it, just make sure you clear your nose first. Just blow it a little bit and make sure your nose is clear, and then you can apply it. And one more important thing you have to know is it comes in two forms. One is a spray and one is a drops. So when you're putting drops, your head can be tilted backwards and then you can apply the drops. But when you're putting the spray, it's the other way around. Okay, you can't put your head backwards and put the spray. You have to tilt your head front and you have to put the spray. Okay, also when you're using, I told you each nostrils. Okay, you're not applying it directly on each nostril. So for example, if you're putting it on your left nostril, use your right hand. Okay, if you're putting it on the right nostril, use your left hand. So basically when you put it, it has to go at that correct angle. Otherwise what happens is it can go directly into your throat. Okay, so that is what happens. So spray, tilt your head frontwards. Okay, and for drops you can tilt your head backwards. Okay, and some of these drops has to be primed also. So make sure when you're getting it from the pharmacy, you have to prime it, or is it already primed? Okay, make sure you check that. And some of the drug interactions. Okay, so it decreases the effects of esketamine and fentanyl okay, and it increases the effects of doxorubicin and other sympathomimetics, and this particular drug will be decreased when you're giving it in combination with alpha 1 blockers or tricyclic antidepressants, okay, and this particular drug will increase if you're giving it with atomoxetine and other ergot derivatives, okay. So this is basically the summary of this particular drug, Xylometazoline. So can we have a quick recap on this particular drug? Okay, so so what is the mechanism of action of this drug, Xylometazoline? Alpha 1 and alpha 2, okay. So alpha 1, what is the action it does? Vasoconstriction of what? Arterioles, where all? Nasal mucosa and conjunctiva, okay, and some of the brand names, okay, Sinex, okay,
Along with
fine.
this, there is also Otrivin, which is there.
Yeah, that's also,
Xylomist.
yeah, Xylomist, that is also there. And what are the ADRs? Okay, what category of drug this is? Category C. Okay, now what are the doses of this particular drug? For drops, what's the concentration? 0.1. How many times? How many drops? 2 to 3 drops. And what about the metered spray? 0.1. Okay, and what about the normal spray? 0.05 to 0.1. Okay, can it be given to children? Only above age of 2 years. Yeah. So what are the uses? Clinical uses? Epistaxis and red eyes. Apart from red eyes, I told one more thing also. Facial redness. Okay. Yeah. So that is basically about Xylometazoline. Thank you.